timer also for 4 minutes for the speakers.
Yeah, yeah.
Okay, doctor. We are live now, doctor.
Thank you. Should we start?
Yeah, Gunjan, be a little loud.
Yeah. So, good evening, everyone. I welcome you all to the interesting episode of MOS and YOSI debate. And we have star-studded event today with all the beautiful speakers and the panelists with us. So, I would like to introduce Dr. Santosh, sir. Actually, sir does not need any introduction. He's the supreme judge for tonight. Then coming on to Dr. Anaga ma'am, she's a chairperson of tonight as well, and she also does not need any introduction. We have two judges, which is Dr. Kuresh sir from MERS and Dr. Sonal Kalia from YOSI. And we are two moderators, Dr. Piyush sir and me, Dr. Gunjan. So to introduce Dr. Santosh sir, sir doesn't need any introduction first of all, but he is known as the ocular oncology person, and he has set new benchmarks for everyone. He tops the Stanford list of researchers of the highest impact in India for the fourth consecutive year, and he has major awards and honors to his credit that include the Colonel Rangachari Gold Medal by the AIOS, Dr. Siva Reddy International Award by the AIOS, Shanti Swarup Bhatnagar Award by the Government of India, and also Shield International Award by APAO. He has also received Lifetime Achievement Awards by American Academy of Ophthalmology and highest award of the Royal College of Ophthalmologists. Uh, Dr. Anaga ma'am, she's the president of Maharashtra Ophthalmological Society currently and also member of ARC West Zone AIOS. She's also vice chairperson of West Zone ISMSIS and executive member of IRSI. And she's a member of Women Empowerment and Networking Committee, and also many she's a zonal member as well, and many other things she's been heading over since long time. And she's also a part of scientific committee of MOS and AIOS newsletter as well. She's currently managing director in Anil Eye Hospital Group, and she's a chairperson at Gopal Krishna Charitable Trust. Welcome, ma'am, to tonight's event. Uh, so we have two judges, Dr. Kuresh Maskati sir and Dr. Sonal. Sir also does not need any introduction. He has passed his post-graduation from KUM Bombay, and he's super specialized in diseases of cornea and anterior segment microsurgery from USA. And he's the only ophthalmologist in the world with extensive experience in both Pintucci and the Boston keratoprosthesis. I welcome you, sir, tonight for the interesting debate session. I'm highly obliged to introduce Dr. Sunal. She's associate professor at Department of Ophthalmology at SMS Medical College, Jaipur, and she has been an immediate past president at YOSI in the past term, and she does not need any introduction in a lot of terms because she has been heading all the things with star-studded events and everything, and she's always been a backbone for everyone. So these are panelists, including Dr. Vaishali, Dr. Aditi, Dr. Pratima, Dr. Prasanna Ramesh, Dr. Arshi, and Dr. Pranesh. So Dr. Vaishali is a professor at GMCH Chhatrapati Sambhaji Nagar, and she has a huge teaching experience. Dr. Aditi is working as a consultant at Sunayan Oculoplasty Center and Aster Adar Hospital, Kolhapur. Dr. Pranesh is working as a cornea and refractive consultant, and he has done his post graduation from Puthuswamy Virtual University and Eye Foundation Group of Hospitals. Dr. Prasanna, he has been a backbone for YOSI as well. Dr. Pratima is also working as a cornea and anterior segment surgery consultant. And Dr. Arshi is associate professor at Guru Nanak Eye Hospital in Delhi. So these are the debate sessions that we'll be taking on tonight, and this is the first debate that we'll be taking over. Our speakers are Dr. Lipi Mittal from YOSI and Dr. Astha from MOS, and they're talking about long-term fellowship versus short-term fellowship. So I take permission from Supreme Judge and the chairperson for tonight. Should we start, sir and ma'am?
Yes, absolutely. I think Dr. Santosh sir, a few words before we start.
I think it's a great idea.
everyone is confused about what to do, after residency and what kind of fellowship they should do. I think with so many debates and so many points of view, I think at the end of the session you'll leave everybody confused, but at the same time that will set them thinking at least as to how they can best utilize the post-residency period to choose a fellowship.
So, are the speakers ready?
Yes.
Yes.
All the best to everyone. All the best.
Thank you,
Thank you,
ma'am.
ma'am.
So, Dr.
We decided upon this topic because this was something which has not been, really dealt with of late, and we thought let's make it little more interesting. So it's Moss versus Yossi. So
Okay.
let the debate begin. Yeah.
Lippy, can you start?
Yes, I'll share my screen. Just give me a second.
You have 4 minutes to speak, all the speakers.
So, I'll start over the timer as soon as you start. Okay?
Okay. So good evening, everyone. Thank you, MOS and Yossi, for giving me this opportunity. Since I was a long-term fellow, I was beaming with excitement when I got to know that I have to advocate for it in a debate. So let me begin with the simple truth. What is visible at the top of the surgery is just the tip of the iceberg. The real surgeon lies beneath. Just, am I audible?
Yeah.
Okay,
Yeah,
sorry.
yeah.
So what takes time is judgment, complication management, decision making, and accountability. You cannot rush these. A short-term fellowship may teach you how to operate, but a long-term fellowship teaches you when, why, and when not to operate. So a long-term fellowship gives you three pillars: competence, confidence, and credibility. The more time you have, the more patients you see with different clinical presentations. You recognize different clinical patterns, which help you in sharpening diagnostics and a better planning. So, your OPD forms a strong clinical foundation. Surgical volume matters, but it is not just about numbers. Repetition and with responsibility also matters. So, repeated surgeries refine hand eye coordination, it develops muscle memory. Long term exposes you to routine and complex cases as well, teaches real time decision making, and it helps in building confidence to operate independently. Confidence is something which is earned case by case and month by month. The real test comes with complications and its management. A long term fellowship exposes you to early complications, late complications, and unpredictable complications as well. You learn crisis handling, you develop strategies to prevent those complications, which helps in building confidence under pressure. My mentor used to say, make as many mistakes as you can in your training so that you're better prepared for tomorrow. A surgeon's job does not end just after OT. Patient follow up is as important. You learn what worked, what did not work. You learn about post operative care, patient counseling, and satisfaction. So, a patient follow up is as important as a good surgery, and it helps in transforming a trainee from a fellow to a responsible surgeon. Another important advantage of a long term fellowship is stronger mentorship. A strong mentor mentee relationship is not built in days. It takes time, it takes honest feedback and graded responsibility. It gives you strong recommendations, guidance, and job opportunities as well. So, a long term fellowship just don't train hands, it gives you better career opportunities as well. So, a long term fellowship, along with clinics, operating room, managing complications, also give you academics as well as research opportunities, thereby giving you a holistic approach in shaping your career. So, in the
1
end, we
minute
all
left.
want to become a confident surgeon, but it takes time. So, surgery does not respect shortcuts, neither should your training. Remember, a strong building with strong foundation may stay taller even for 1,000 years. Thank you.
Very good,
And crisp. Yeah,
very,
sorry.
very good, Lippy. So we can perhaps go on to the second speaker, and then we'll try to debate it out. So Dr. Asta Singh, who's going to be speaking
Yes,
on
sir.
fellowship.
I'll share
Please
my
share
screen, sir.
slides.
Just a second, sir. Can you see it?
We can see. Please go ahead.
Okay. Hello, good evening, everyone. I'm Dr. Astha Singh, and I have done long-term fellowship, but I'll be speaking on short-term fellowship here. And while researching on this topic, I have got a lot of points over here that actually favor the short-term fellowship for a considerable number of people. Can you see the images, sir?
We can.
Okay. So the agenda for today for me is that to improve the understanding and the variability in fellowship durations and their implications, and guiding the present future of ophthalmologists so that they make the right decision while choosing the fellowship that they want to pursue in the future, and also using my personal experience in guiding this discussion to its proposed ending. Starting with the short-term fellowships, the duration starting from around a month to under 6
Sorry,
months.
Asta, are there pictures along with it
Yes,
on
sir.
the
Are
right
you
side of
able
the
to?
screen? No, we are
Yes,
not
sir.
seeing the pictures. I'm
Oh,
only reading what you've written.
but why so? The
The
pictures.
question mark is visible over here.
Yes, ma'am. I can see it on my screen as well. Just a second.
Perhaps you can just end it and just restart once.
Yes, sir. You're still not able to see it?
We could see it when it was not in the mode.
Yeah, it's below in the slide deck. It is visible, but it is not in the main thing. I think the Canva is not loading properly.
Acha. But those are just like cartoon images, nothing relevant as such. But it was just for the presentation. If it's okay, I'll just continue with my presentation then.
Yeah.
Yes, Dr. Asta, please go ahead.
Please go ahead.
Yes, sir. Okay, so starting with the short-term fellowships, the duration is around 1 month to under 6 months in most of the institutes, but it can be extended. And if one wants to continue working learning over there, all of them are paid fellowships, but obviously that is a part of concern. But you can see it this way, that the money invested is used in enhancing the skills, which will eventually pay you back manifold. And it is especially suitable for those who just want to brush up their skills with any new technology that has come up, such as in refractive surgeries, we have Silk, Smile, and even in corneal surgeries. So anyone who has those machines and just wants to upgrade it, then they can actually go ahead with these type of fellowships. Then there are certain hospitals, especially which I've heard in Mumbai, since I am from Mumbai, that they offer different time slots throughout the day. So for people who are working in the morning or maybe in the evening and they still want to enhance their skills, they can go for these kind of fellowships where they can, work as well as train at the same time. And some people who already have the basic cataract skills can also go for advanced trainings in such types of fellowships, which are there around for a month or 2 months fellowships. And just like I said about refractive surgeries, we have certain fellowships that also cater to other types, other branches of ophthalmology, like we have for ocular aesthetics, oculoplasty, ICL surgeries, and in glaucoma and medical retina. And people who already have an established setup in their places, in their own places, they can continue and learn different types of skills of other branches of ophthalmology to enhance and expand their own OPD setups. Moreover, those who didn't have a good teaching experience in their own PG or in their own colleges can also benefit from these short-term
1 minute
programs.
left.
Okay, ma'am. Short-term programs, because like if they're planning to directly start up their own clinic in their own hometowns, then such short-term fellowships really benefit them. And they also have a chance to work with and under distinguished teachers like you all. And shorter duration obviously means that they have more family time as well, because long-term fellowships allow them to stay away from family for a long time with very limited number of holidays given to them. And sometimes career gaps in the form of pregnancy or post-pregnancy or maybe some kind of any chronic disease can also bring a wave of self-doubt in them. So these short-term fellowships help them to regain their confidence and so that they can continue in the same field. It also provides some sort of break from the usual routine to spend some time in a new city or location. This is some sort of a non-ophthalmic point, and it also helps to fill up your clinic walls with multiple degrees. So patient impressed and doctor is busiest. But when it comes to short-term fellowships, the duration is obviously longer. It is from 6 months to 3 years. It affects the personal life because we join fellowships at a time when we are at a stage in our life when our parents insist that we get married or we settle down, or we already have settled down, we want to have kids and all. So this fellowship is the time when you have to stay away from family, and that is how it can affect your personal life. Disappointing pay, I think there is a lot of discussion that we can have on this, but yes, that is the truth which even I have faced. And the work timings are also not stable like a 9 to 5 job. You have on-call duties, you may have extensive work, OPD works and OT work as well. And like I had done from my government college, so I had my bond duty. So same way all over India, we have different types of varying duration of bond duty. On top of that, if we want to do a long-term fellowship, it becomes a really long stretch of time for which we are continuing with our education. And people who are from North have trouble with the language in the South and vice versa. It also feels like an extension of residency. Yes, ma'am. I didn't get time in the beginning. That's why. Just 2, 3 more slides, ma'am. It feels like an extension of residency period also in some institutes and some institutes have started imposing bond post completion. So that also adds up to this. The most important thing that I want to point over here is that there is no uniformity with respect to fellowships all over India. It is variable, and that is why people have confusion as to what they can learn in a different type of institute, even for the same type of fellowship. And there is no defined syllabus or a protocol in the same institute for different departments. One institute can offer certain types of surgeries or can offer cataract surgeries on top of the specialized program, but not for the other departments. And unlike any other super specialization like MCH, majority of our fellowships are not recognized by any university. And in many subspecialty programs, the cataract surgeries are not offered, which is actually the bread and butter for our departments. And certain institutes also don't favor CPS DOMS candidates for their fellowships. So the only option they have is short-term fellowship. And sometimes certain seats are reserved for influential candidates or people who are already been picked beforehand. So the worthy students lose on the seats. And many a times female candidates are also rejected because they have an imminent pregnancy or marriage that is being planned. And so they take a long break. And for that reason, they are not given the seats. So what can we do over here? So we should always research well before finalizing the fellowship. And it is not the end of
I
the
think
world.
we need to stop now.
Yes, sir.
You're
Yes, sir.
far
I'm done,
exceeding
sir.
your time. Yeah, even over
Yes,
the
sir.
time that was given. You need to,
Okay.
stop
I'm done,
immediately.
sir. Thank you, sir.
Go
Okay,
ahead.
thank you, Asta. You've jotted down the pros and cons very nicely. I'd like to ask you a question as well as one of our expert panelists,
Yes, sir.
perhaps Aditi Watve Pujari. Now, what do you think, in your opinion, at what point does a long-term fellowship become diminishing with regards to returns in terms of financial or emotional?
So it matters more when you actually have don't have a strong financial background, and since the pay is not good, so there's a financial struggle involved in it, and especially if you have a family to take care of. So that time it is a struggle for a lot of people.
Dr. Aditi Pujari, are you there?
Yeah, I'm there. Hi. Glad to be a part of this interesting debate. Since I have done my long-term fellowship, I may have a bit of leaning towards the long-term fellowships. But at the same time, I feel it needs to be customized. It needs to be decided as per your needs. Uh, I guess the candidate needs to have some idea what exactly they want to do about the ophthalmology and overall their life. So, for example, if they want to go to a smaller place where CV is not going to make a big difference, and skills matter more, then the choice of institute may be slightly different than candidates going to metro cities where CV equally has importance along with your skills. So I think it needs to be customized in my opinion. And I must agree that both the candidates have put their points very nicely towards the pros and cons.
Okay, so I have another one, this time for Dr. Lippi, and perhaps somebody from the YOSI gang. Dr. Prasanna, I think, is a fantastic person to answer this. Now, this is a very confusing question in a lot of people's mind, not just now, but even when I had undergone fellowship. So, there were so many short-term fellowships that were available, and there were so many things that one wants to learn. So one thinks whether should you club multiple short-term fellowships or you just go for one long-term fellowship. So do you
So,
think that there is a possibility that people can club multiple short-term fellowships and that would equal to one long-term program, Lippy and Prasanna?
Sir, I think skills is something that we should marinate with time. You can't just microwave skills. You have to marinate it in order to have a good taste of success and skill, confidence. Similar is, I think, if we combine multiple subspecialties or multiple short-term trainings, we can. I mean, it's up to one where do they want to practice. They can choose if they want to be the jack of all trades and master of none, or they want to master one or two subspecialty and be confident in practicing that and becoming an independent surgeon. So I think it is up to an individual, but I believe a long-term fellowship provides and offers more skills and being to become an independent surgeon in the end. I think Prasanna sir.
Yeah.
So
So
you
just to
think that
complete.
multiple short terms is not equal to one long term? Prasanna,
No,
what
sir.
about you?
I
No, sir,
totally
because
agree.
no.
Got it, got
Just
it.
I totally agree with you and Lippy on that, sir. Multiple short-term fellowships, again, the preference what the candidate wants, if they are practicing in a place where they are a solo practitioner, usually we see in our center people choosing a medical retina or another short-term program. They will be an anti-segment surgeon, but coming for a medical retina program. So they do it predominantly because they say that they are the only surgeon who's going to have a setup and that's how they are going to do it. But otherwise, another way of seeing this is in glaucoma when mix came into the picture, sir. Having a long-term fellowship and then upgrading your skills in a short-term basis, either in India or going abroad for a short-term program. I think that's the true way where you can master a subspecialty. But if your practice caters a need where there are some financial constraints, as Dr. Asta was mentioning, or they are very clear that they want to operate cataracts and do medical retina because they don't want to miss out on that as well. So they are very selective in that approach. Then it works well for them. But academically, I don't see that career kicking off in a truly subspecialty way. Yeah.
So another one in favor of saying that it is not equal, a long term is superior to multiple short terms. So we will move on to the second debate. I would also like to request our judges to please come in any time and ask any question. If there aren't, then we'll keep moving on to the subsequent debates.
Can we not finish one topic and move to the other, or do you want everything to be discussed? Because I don't think then people will be clear, isn't it?
So should we, you mean to say we go through all the debates and then have discussions?
No. I think we should just
Okay, sir. Okay, sir.
go per
So
set.
got it, sir. So we'll move on to the next debate, which is
No. I meant just finish this off, go to a conclusion, and then move on to the next
Yes, sir.
set of debates.
Yeah, so initially, yeah. So, sir, that's what it was decided also. So, I would like to ask both our judges, Dr. Quresh Muscati, sir, and Dr. Sonal, to give their verdict for tonight for the first debate. Dr. Quresh, sir.
Yeah, so Lippy presented it well within the time. According to me, right from the beginning, when you're making debate presentations, you must practice what you want to say. You must choose the number of slides that you will be comfortably be able to manage in the time slot allotted. Now, you've been allotted 4 minutes. You cannot have so many slides as were presented. You have a lot of matter to give, but you need to pick and choose what matter is important to. Just salient features is enough. You have an intelligent audience, not so intelligent judges, but we get the picture in 4 minutes. So we must be able to distill that. And unless you do that, it gives you negative marking as far as the judges are concerned. To me, the winner of this first debate is Lippy for the long-term fellowship. She articulated her position quite well and gave all the points for the long term while not denigrating too much the short term. Yeah. Thank you.
Thank you, sir.
Sonal, ma'am.
Yeah, for me also the winner is Lippy, and the reason is not that Asa did not present her points well. I just want to congratulate Dr. Asa for bringing out a lot of points,
I am not trying to cut her marks for the exceeding the time and all, but my request to her was that instead of highlighting the negative aspects of a long-term fellowship, you should have either focused on the positive aspects of a short-term fellowship more. Like there are a lot of people who are stuck in in government jobs, in faculty positions, and even in SRships, where if they do a short-term fellowship, they have a lot of human material to practice those skills on with the guidance that they have received there, and then go back to those faculty for the problems they get further. So not to say that this will a short-term fellowship is a substitute for a long-term fellowship, but highlighting the merits of what you are focusing would have been a better approach to favoring your perspective, rather than trying to find that people with the approach get selected in long-term fellowships more. And I mean, these are not the points to be discussed here. Here you should focus on the merits. That is all. And I congratulate Lippy for a very well presented and positive presentation. Thank you, ma'am. Thank you so much.
Thank you so much. Anaga ma'am, any verdict for tonight?
Dr. SH?
I
Yeah.
think all are fine. Yeah. Very, very well done, both of you.
I think both of them made very good points. Asta's points are very well taken that short-term fellowships are relevant, but you can't call short-term fellowships as fellowships. They're only training programs, basically. 3 months or 1 month can be called a training program. Fellowship by definition is 1 year plus. Anything less than 1 year can be called a short-term fellowship, but it is actually a training program, and these are skill enhancement programs. If you are a general ophthalmologist, you want to learn additional cataract skills, or if you're an oculoplasty surgeon, you want to do suddenly endoscopic dacrocystorhinostomy. These are courses or programs where you can enhance your skills. Or you are in the midlife and you don't know really what to do and you want to upgrade your skills, you go abroad and learn a new skill and come back. That is a short-term training program or a short-term fellowship, if you want to call it. But the long-term fellowship is the gold standard of training anywhere, because you, from a generalist like a ophthalmologist who is a resident ophthalmologist who has been trained in general ophthalmology, are trying to become a specialist. And for that, long-term exposure, as Lippy pointed out, a lot of grounding, mentorship, and when not to do surgery, when to do surgery, when not to treat a patient, when to treat a patient, when to refer, what are your limitations, all that will be crystallized over 1.5 to 2 years or even 3 years. So anything that is less than 1 year cannot be used for subspecialty training, at least now, because each subspecialty is so wide and has expanded beyond realms. So that is my conclusion, that short-term fellowships are relevant, but they can be called training programs, whereas long-term is the gold standard for somebody who's starting a career. Unless, of course, there are limitations that you pointed out, which are going to be there in life anyway.
Sir, to add on to this, according to you, what is your verdict about the winner for this debate?
I don't have a winner or a loser here because I think it's a learning issue. Both of them did very well.
Okay. So
So
tie
with
for
this,
both the
yeah.
speakers for evening,
Now, so
for the
we'll have to
debate.
move forward. Gunjan, it's
Yeah, yeah.
already 8:30. And the second,
Yeah.
we'll move on to the second debate, which
Yes.
is essentially a comparison between fellowship in India, which is going to be defended by Dr. Roleka Bansal, and an overseas fellowship, which is going to be defended by Dr. Aditi Joshi. So, Dr. Roleka, if you can please load your.
Yes, sir.
I thought Rolika would defend international fellowships.
Fine. This is
So,
the biased
my wicked
judgment.
plans.
Maybe she learned more with you than in her international fellowship.
Okay, so my screen is visible, sir.
Yes, Rolika.
All right. So I'll be talking about, so the motion for this debate is a fellowship abroad is more valuable than the one in India. And I am Dr. Rolika Bansal and currently practicing in Jaipur. And I have trained in India and 2 fellowships in US. It's very ironical that I'm speaking against the motion, and that is it becomes, in a sense, becomes a fellowship abroad is not more valuable than the one in India. Correct. So I believe in the concept of statement, thought, and perception. That is, a statement is perceived in a particular way based on our own thought process. And over here, we can read the statement as a fellowship abroad is not more valuable than the one in India, Or we can read it as a fellowship abroad is not more valuable than the one in India. So while overseas fellowships add value in terms of advanced technology and global exposure, they're not inherently superior than Indian fellowships, but are rather equal in their own way because knowledge has no boundaries, it just flows. So my journey started in India with my fellowship, and then second in US, in Philadelphia, San Diego, and now I'm back to my own country. And when we talk about that, so India, as such, I firmly believe that Indian fellowships are uniquely framed to train ophthalmologists for the realities of our healthcare landscape, which are supplemented by ideal patient population for high volume learning, novel approaches as per international standards, diverse patient population, innovation mixed with high level jugaad, and availability of a wide range of rare benign to malignant lesions. What do I mean by that? First point is we have 10x high volume compared to the other countries. It's a fact, it's high reality. Hands on surgical experience the fellows get early on in their career with supreme and intense training. Let's not forget about the intense training that we have in India. It's actually good and disciplined. High number of independent surgeries are being performed by the fellows, and international fellows actually look for opportunities in India. In fact, 2 or 3 centers that I would probably not name right now, they're actually famous for the international fellows to come over here and perform surgeries. We have novel approaches. Availability of cutting edge technology in India times have changed. From older times to now, we've gone way far. Indian centers are at the forefront of innovation. Fellows are exposed to novel approaches. Protocols are made right here in India as well. In fact, I will be surprised if I say that when I went to US, Dr. Shields actually told me that we follow the orbital retinoblastoma protocol, which was stated by Dr. Hunavar in India. So that means we have already set standard over there. We have to value the made in India aspect, which is very precious. Then we have the diverse patient population from rich to poor. We have everything. Fellows learn to provide care to all in a cost effective manner. Highly accessible healthcare for all is possible over here, and quantity with quality with no compromise at all can be provided. Let's not forget the Jugaad level. Fellows work in resource constrained settings. Innovation and adaptability are the keys over here. Optimized outcomes with limited resources, invaluable skill learned to address the nation specific unique challenges with a global network which has put us on the map. And also, we have, if I talk about ocular oncology, specialty specific example, high variety of benign to malignant tumors applicable for variable approaches with a mixed bag of management protocols and beyond protocols. Every case is a mystery and a challenge. For my disclaimers, no one can ever choose between teachers and knowledge providers, as I have learned in India and US both. I absolutely have no financial interest, but I wish I did. And every fellowship is a challenge which is designed to teach us something beautiful. And I speak on behalf of both me and my opponent that this is how my fellowship has trained me. It has trained me from one fellowship to the other and has made me a better person in general. So I thank everybody who has crossed me on my journey, and and my slides are not moving. So yeah, this is all the people who have crossed me on my journey. And I must say, whether India or abroad, everybody, the connections that I've made are memories that are for life, which could have not been made if I had not taken this particular initiative. So thank you very much for listening to me. And I would just, my slides are not moving. Yeah, so please go find your home in India and beyond. And Indian fellowships are actually equally valuable to the overseas fellowship because knowledge has no boundaries. Thank you so much.
That's great, the information that you've given us, Solika. Now we'll move on to Dr. Aditi Joshi, who's going to be speaking about fellowship overseas. Can you share your slides, please? Dr. Aditi Joshi? You will have to unmute yourself, Dr. Aditi.
Yeah.
I hope the timer has begun.
No, sir, just a minute, sir. I'm not
Yeah,
able to.
yes.
Just a minute, sir. Yeah, so can you see my screen?
We can see it, but it's gone off from a single slide mode to a smaller. We can see your slides as a very small picture in picture.
Mm.
Go
You
to
can.
the slideshow.
Yeah, I've started the slideshow itself.
Aditi, it's showing your presenter view.
Again?
Yeah, do it the same way that we did. Open the slideshow first. Yeah, open the slideshow first.
Yeah, this is the slideshow.
Yeah, now stay like that. Now go to Zoom and share the
Actually, we can see
screen.
it now.
No, she was fine. She was fine. Yeah,
Yeah.
this is fine. Just go ahead. Click on the slide, it will move.
Yeah, is this fine?
Yeah, you can do page down or click on the slide, it will move.
Yeah, my entire slide is seen, right?
Yes.
Yes, sir.
Yes, okay, sir. So a very good evening to esteemed judges,
You should set your
panelists.
timer again because she's now at 3 minutes 5 seconds already.
Should I start, ma'am?
Please, Aditi.
Yeah. A very good evening to esteemed judges, panelists, and moderators. At the outset, I would like to thank Maharashtra Ophthalmology Society, Anaga Madam and Anamika Madam for this opportunity. So our topic for debate today is Indian fellowships versus international fellowships. And I would be supporting the motion of fellowship abroad is more valuable than the one in India. At the outset, let me get this straight. Indian fellowships undeniably have high surgical volume. The numbers are always in India's favor, have excellent hands-on learning, are cost-effective, and also the demographic and the socio-economic profile of patients and the core learnings from the Indian fellowship are easier to replicate when you go into your private practice. However, Indian fellowships are not without its own set of pitfalls and shortcomings. Though I was lucky enough to have found my dream fellowship, I understand from various discussions that go on from the various forums and or WhatsApp groups anonymously that the fellowship scenario in India is suboptimal. So there is wide variability in training quality, there is no uniform curriculum, and its outcomes depend heavily on the institute and the mentor. Inconsistent hands-on exposure, lack of transparency, the meager stipends, and limited accountability. That is, few outcome audits, complication reviews, or competency-based assessments. So where do foreign fellowships have an edge? Global ophthalmology is rapidly moving towards subspecialization, technology-driven care, international collaboration. So an Indian fellowship can make you competent, but overseas fellowship makes you globally competitive. And in today's interconnected world, competence alone is no longer enough. The question is not India or abroad, is it local excellence or global perspective? One important advantage of overseas fellowships is the breadth and the options they offer. They range from basic science-oriented fellowships where trainees work in laboratories to hardcore research and clinical fellowships with focused subspecialty training. In contrast, most of the Indian fellowships are predominantly clinically focused, with limited availability of structured research training. Also, there can be an argument that these fellowships are expensive and cause a hole in your pocket. But there are many organizations that provide scholarships to fund your fellowship, like the ICO, the APAO, the ICO ABV Advanced Research Fellowship, etc. So why international training feels different? Because they are built as systems, they're structured and protocol driven. They provide early access to emerging technologies. They integrate research and clinical trials into daily lifestyle, and they offer global exposure and networking. You're trained not just how to operate, but how to think, how to audit, when not to operate. Some of the Indian stalwarts who've trained abroad, we know who they are. They are the ones who have started and then the vitreoretinal surgery in India. They remind us that global exposure does not dilute Indian ophthalmology, it strengthens it. As ophthalmology is rapidly evolving, it is becoming data-driven, AI-driven, and gene-driven. Therefore, we must ask ourselves, can we truly lead tomorrow's ophthalmology using yesterday's exposure? So if your goal is to follow existing systems, local training is sufficient. But if your goal is to influence systems, contribute to guidelines, participate in research, and shape the future of care, then global exposure becomes invaluable. So to conclude, Indian fellowships build surgeons, overseas fellowships will build leaders, innovators, and global voices. And in a globalized world, why should your training remain local? Thank you.
Thank you very much, Aditi. It was very beautifully presented. Now, I'd like to ask Rolika and one of our panel from YOSI, Dr. Pranesh Ravi, perhaps. For someone who's planning to practice in India, what exactly should you look for in an overseas training? What should it add, basically, to your decision to move there and to come back to practice in India?
Right, sir. Would you like me to answer first, or Dr.
Yes,
Ganesh,
yes,
would you
Rolika.
like to answer? Okay, so when we go overseas for a fellowship, we're kind of looking for a structure. We're like kind of looking for research and innovation mostly. We have a set pattern, whatever we have learned in India, that's going to be our base always, because we are in this particular system. If we are supposed to practice in India, it's you have to understand that you're going there to learn an additional aspect, come back and apply it to your current practice. That's what you should keep in mind. So you're going there to look at their system, look what's going on, the discipline that they have, the protocols that they follow, and then try to think about how you can implement it going back home. This is what you have to keep in mind. Basically, the basic technology and everything are pretty much similar, at least in our field. I think our mentors have made sure that everything that's available in America or beyond is also available in India. So it's about, in the current times, everything is equally available. All we have to see is what exactly we can add from that to this. And of course, research, they land up doing more research because, of course, they have more time. We have more patience. So we have to kind of come to a common ground over there. So applying what we experience over there, that's the essence.
And also the pathology is different. So when you summate into Indian fellowship with an international fellowship, then you are almost 360-degree covered. We have less melanoma, so we don't see the entire spectrum of melanoma as a society, as a kind of ethnic group. We have very few melanomas, whereas in the West, melanomas abound. We have a lot of retinoblastomas, whereas they have very few retinoblastomas. So when you put all the pathology together, then you become well-rounded. So that is one aspect of doing an international fellowship, at least in ocular oncology and oculoplasty.
Perfect. So 360
add
degrees.
something?
So 360 degrees completion, like you said, adding on to your portfolio. Dr. Pranesh Ravi, your quick take on this?
Sir, actually, Dr. Rolika spoke my mind, sir. If you go out there, if you're getting a niche, a better protocol, or how to go about a niche practice, or how to make it better, so it uplifts your place of practice, and it adds up something, spices up your work protocol, then nothing more than it, sir. If they have the time and are able to generate a protocol where it is beneficial for them, then it is better to go there, learn it, and then apply it in our country.
Perfect. So another quick question for Aditi, and then to Dr. Vaishali Une, who's our expert panel from MOS. So looking at your presentation, do you think that an overseas training is always going to translate into better clinical confidence once the surgeon is back in India? Dr. Aditi?
Sorry, so I did not get your question. Overseas
Do
training?
you think that an overseas training, it'll always translate into into better clinical confidence for the surgeon once they're back in India? After you do your fellowship,
Surely,
your
surely.
overseas training, it is always going to translate into better clinical decision making or confidence once the surgeon is back in India.
Need not be always. It also depends on what fellowship you had gone for. So if it was a basic science or a clinical translational research fellowship, it may not translate exactly when you come back and you see your patients in the clinic. So I think it depends on what type of fellowship you've gone. But there are some very high volume surgical centers even abroad. So if you have done one of those fellowships, then I think definitely it will translate.
Dr. Vaishali Une?
Yeah, I do agree with Dr. Rolika Bansal, but I think it's better to have best of both worlds. Though I don't have a experience of foreign fellowship, though I just had short-term like observership at Milan. So what they said, yes, of course, we have their cutting edge, the recent advances, but we do have the number. So coming back, learning from them and coming back, and we have those number of patients, especially I'm working in a government medical college. So that is truly helpful, I guess.
Dr. Piyush, can I add something? Am I audible?
Yes, quickly, madam.
So what I would like to say is that like I've done both kinds of fellowship, international as well as national fellowship. So what someone needs to understand is that these national fellowships are basically observerships. Okay, so you don't get hands on them in them. So these are to widen your perspective, like what is there outside of India, and it also depends like where you have done your fellowship or your residency and when are you going. Like, are you going directly after residency? Or are you going after a specialization? Okay, so if you're going directly after your residency and you have done maybe from a setup where you did not get the opportunity to see much, then it will add up to your perspective of different what else is being done apart from whatever was being done in your own hospital. But supposingly you have done a fellowship in a very high level of institute, like suppose from like I was from LVPI, so I could see everything there. So it was like I have already done all the surgeries, I have already done everything. So then it shifts to a cultural aspect more than learning just surgeries or something. So if anything new is there that you learn, but you also have the confidence that okay, whatever you have learned was not less. So in like even in India, if you have done a fellowship, you are not anywhere behind the world. So it gives you a very broad perspective in that point of view also, and it adds up to your research, your collaboration, and all those things. But it depends
Point
where you
driven,
did.
ma'am. Point driven, ma'am. We'll ask
Yeah.
you another question in one of the other debates now. So we'll quickly
Yeah,
take
sure.
the perspective of judges, and then we'll move on to the next debate.
Yes, yes. Thank you.
Thank you, Piyush. So, Rolika, you had the easier of the two in a debate where you're talking about Make in India and Made in India. It's very easy to defend or to promote Indian fellowships. You did a great job at that, but I think Aditi Joshi takes the cake because I loved your slides. I love some of the ways that you put it. Some of your statements that you made. And you really made a good, compelling case for international fellowships. Of course, the best always will lie in between. Those who are privileged to do an Indian and an international will be ideal. But I loved your presentation. So I would give the winner of this debate to Aditi Joshi. Thank you.
Thank you, sir.
Dr. Sonal and Dr. SH, your
For me, the winner clearly was Dr. Rolika because of her compelling reasons for choosing a fellowship of India first. Having experienced both of them herself and not just one, two fellowships abroad, she still is defending it very convincingly. It was not that, sometimes when you're not convinced yourself, you really cannot make a point across, even if you want to. So it did not, her impassioned, delivery of the topic showed that she had conviction in her training in India, and thanks to her mentor, I'm sure. But otherwise, also, she's given very, very good reasons for even if standards may not be maintained in all centers the way her center is maintaining. But otherwise, also, the reasons are very good. And definitely, the ideal would be somebody who has an exposure in both. And if not, at least an Indian training is something which is not less in any way to the international. That's the point that is being actually debated here. So you cannot really replace the Indian fellowship with an international one. That's the point that I think I want to get across, that if you're able to get an international, very good. If not, an Indian training is not subpar in any way. Yes, the examples of, those stalwarts, Nagpal sir and all are very good points. But that was a time when Indian fellowships and Indian structure was not that good. That was a time when, Indian people were not even probably doing ECC, etc. at all centers. It was something which was a very nascent stage. Now Indian ophthalmology is nowhere less at any stage. All ophthalmology conferences have Indians winning in each and every category almost. So any training in India is not inferior. Yes, if you have both, to your added to your resume, it's feather to your own cap in a way, but it's not inferior in any way. That's the point that Rolika drove across, and I really applaud her points.
Point well taken, ma'am. So, Dr. Anaga, ma'am, would you like to add on?
Dr. Santosh was to say something.
Oh, so
Yes,
sorry,
sir.
Mhm.
Yeah.
Sir, please.
All right. So I think Rolika obviously speaks well and she spoke well too. Aditi also made extremely good points, and both are essential. As Rolika's last slide showed, Indian fellowship is the cake and perhaps the icing as well. And the international fellowship adds icing to the cake and maybe a cherry on top. So both are essential. If you're lucky to do both, that is great. And Pratima made excellent points. International fellowships are not hands-on, except a very few. So you get the satisfaction that the training that you have got in India is already good when you go internationally. Really a steroid to your confidence. It boosts your confidence and it shows that you're already doing well. And beyond that, of course, you learn several skills there, especially how to talk to patients, how to counsel them in a difficult situation, how to organize research, how to do research, how to organize your clinic, and the value of time. They value each minute, whereas we don't value even hours. So all that put together, I think both are a very good combination. Maybe tadka to a dal or icing to a cake, whatever you want to call it. But if you want to do both, that's great.
Yeah.
The base will also
I think,
always be an Indian fellowship.
right. I think both of them spoke really very well. It's very important for us to know what we actually want. Where do you want to go in life, what you actually want, and then that decision can be taken. I think everybody put their points very well. Nice debate.
And the practicality of whether it's possible for you to really travel abroad and stay there for the
Right.
duration of time. So Gunjan, would you like to call the next set of speakers?
So I'm moving on to debate 3. This is senior residency versus fellowship. So Dr. Sonam will be talking on senior residency. Dr. Sonam, please share your slides.
Am I audible? Good evening,
Yeah,
everyone.
very well.
Yeah. And YOSI for this wonderful opportunity. So I'm going to put my point forward. My motion is about senior residency is better than fellowship. So senior residency, according to the MCI, is defined as a tenure of up to 3 years for after post graduation, and those who are pursuing super specialty up to the age limit of 45 years, but it's up to 50 years for non-clinical branches. And these roles are basically meant to bridge a gap between the PG students and the faculty, which offers experiences in the form of teaching positions. At the same time, it also fulfills the eligibility criteria for future faculty positions. SRship is better or fellowship. So the two parts are there, like senior residency is up to 2 to 3 years. It is more of a comprehensive training, but you do have a clear-cut specialty-wise senior residency, and also our institute also offers MCH in retina and cornea fellowship, cornea MCH SRship. So it's more of a holistic program which covers the full spectrum of ophthalmology. Other than that, the fellowship is up to 2 years and is specialty focused, and it also has deep dive into the single specialty, more of an expert in a narrow field. Dr. Gurnani et al. Published in IGO actually shows us the big time financial reality that senior residency offers a significantly stronger financial start to the careers of young ophthalmologists. We are in the late 20s, and you really are not a complete, don't want to be dependent on your parents or other people. So you really would have want a good stipend. So here you can say there's a seismic difference in the fellowship stipend compared to that of the monthly stipend of the senior residency. Where senior resident can earn up to 30 lakhs, while fellows are up to only up to less than senior residency and fellowship salary. Then real world skills. Dr. Srivastava et al. Has shown that 85% of the Indian patients basically need not just subspecialty. So senior residency basically gets an all-rounded approach to ophthalmology. At the same time, they get to treat patients from other spheres like cataracts, emergency retina, glaucoma, and pediatric ophthalmology has as well. And most of them are stationed and high volume setups, and they get to share the real responsibility in decision making. While fellowship is more of a tunnel vision or more of a secluded thing, and most of the fellowships offer specialization in specific branches, but they are very limited in India. Protocol in senior residence connect with the academia with built-in research and teaching infrastructure, which is part of the curriculum of a senior resident. It provides consistent mentorship in the form of the faculty. Departmental audits take place every now and then. Index journal publications come up. While in fellowship, you are unless you have actually opted for a research-oriented fellowship, you don't get to do that. At the COFRCS exams, which are also quite costly, and the academic engine is more than just the explain, and of course the MCI guidelines, which actually needs senior residency, 3 years of SRship, which is actually faculty position in a government college or an institute. So verdict is that senior residency is like the foundation of comprehensive training, academic publication, and a substantial salary, which actually in future you can opt for an optional fellowship if you think that your fellowship needs more standardization, while fellowship maybe not so much. It is complete, and it is not better than fellowship. It is in fact complete by itself. Okay, thank you very much.
Dr. Sonam for this wonderful discussion. Now I invite Dr. Akash to talk about fellowship. Are you there, Dr. Akash? Please start.
Yes. Am I audible?
Yes, very well. Start sharing your screen.
Is my screen visible?
Yeah.
Yeah. Thank you. So good evening, respected judges, faculty members, and my dear colleagues. Today I will be speaking in favor of fellowship over senior residency. Myself, Dr. Akash Raghuvanshi. I am pass out from Lokmanya Tilak Medical College. I have done my long-term fellowship in cataract and glaucoma from Sadguru Netri Chikitsalaya, Chitrakoot. And I have again come back to my parent institute. I have joined LTMMC Science. So fellowship is more relevant and effective path for modern medical practice is what I believe in. Modern medicine is no longer about being a generalist. It is about being precise, skilled, relevant. Clinical outcomes and quality of care rather than frequency of ward rounds ultimately defines patient satisfaction in modern world. While SRship, you may have routine ward work, heavy OPD load, administrative duties. While these are important, they do not always contribute to advanced skill development. Focus training always accelerates growth. Fellowship focuses on advanced and focused skills, direct impact on patient outcomes. Healthcare today demands specialists, not just service providers. Fellowship offers high volume procedures, advanced techniques, hands-on surgical as well as clinical exposure. Unlike SRship, learning in SRship is often incidental. Fellowship learning is intentional and structured. Fellowship converts theoretical knowledge into real expertise. In today's competitive medical world, corporate hospitals, advanced centers, informed patients all demand subspecialized doctors. Fellowship gives market value, confidence, and recognition much earlier than SRship. SRship gives designation, not differentiation. Skill creates demand, designations do not. Senior residency may take up to 3 years with limited skill progression. Fellowships within 1 to 2 years can make you procedure ready, independent, confident. It also gives you a secured future because skills protect against market saturation, easy transition to private and corporate practice, long-term relevance in evolving ophthalmology. Why spend years doing routine work when focused training accelerates growth? In real-world corporate actively prefer fellowship-trained doctors. Subspecialists get better salaries and contracts, faster recruitment into metro and premium hospitals, clear role definition in subspecialties. Fellowship aligns directly with corporate hiring needs. While some may debate that SRship gives you more academic and it gives you exposure to all the specialties, but then learning has no limits. You can strengthen the foundation, and once the expertise is achieved, expanding knowledge becomes easier and meaningful. That is my belief. Knowledge can always be expanded. Fellowship doctors experience less clerical burden, more procedural satisfaction, greater confidence. Medicine is not just about survival, it is about professional fulfillment. SRship creates academicians in a surgical branch without strong skills. I believe academics lack credibility. A skilled doctor can always learn to teach, but a teacher without skills might struggle to inspire. So to conclude, senior residency builds service providers while fellowship builds experts. In an era driven by precision medicine, innovation, high patient expectations, fellowship is the smarter and stronger choice for modern ophthalmology. Medicine should not only be about surviving the system, it should be about professional fulfillment and pride in one's work. So to summarize, senior residency largely builds service providers who keep the system running, while fellowship builds experts who raise standard of care. Both have value, but fellowship prepares doctors better for the modern practice. Thank you.
Thank you so much, Dr. Akash. Can you stop sharing? In the meanwhile, I would like to ask Dr. Arshi about her inputs for this debate. Dr. Arshi, are you there? Can you stop your slides, Dr. Akash? Am I audible? Okay. Dr. Arshi is there? No. Dr. Pranesh, can you talk about this debate?
Thank you, Gunjan. But
Yeah, Dr.
SRship
Arshi
and
yeah.
she's come. Okay, I'll let her.
No,
Okay,
no,
fine,
you can speak up. Please go ahead.
Yeah, so depends upon the place where you do both. So I think if the obstacle course is the same, then I think only the names differ. So firmly believe that it's mostly depends on the place where you do it, and it's mostly two sides of the same coin. Yeah.
Dr. Vaishali, would you like to speak anything about this topic?
Yeah, I do agree that actually there is a little confusion amongst about the nomenclature. SRship, like in Maharashtra here, we have that after post-graduation, 1 year of SRship is compulsory to get the post of assistant professor. So that 1 year is about general residency. It's just similar to an assistant professor. Whereas what Dr. Sonam is there and at RP Center, SRship is about fellowship. It is 3 years and they are trained into that particular subspecialty. So I guess this might be a little confusing for the opponent. So of course, my thumbs up is for Dr. Sonam. Like SRship definitely has an upper edge because, like she said, there's additional training into administration also, along with the clinical skill. So you become a fellow. It's like a fellowship in that subspecialty and the administrative training, which may help if you are planning to be a academician or take up the post of assistant professorship.
Thank you, ma'am. Dr. Sonam, would you like to add on to anything that you talked about?
Yeah. In a residency, you can have an option because it's 3 years long.
So you can divide it into, three different specializations in the way that one can choose in our institute. Basically, a general senior resident can choose to be in a comprehensive ophthalmology posting, like a rotational posting for a year, and then the remaining 2 years he or she can opt for a specialized senior residency in the field of either retina or cornea or glaucoma for that matter. So that way one gets more exposure. At the same time, being associated with the institute for a longer period of time actually opens many doors, be it research or of course the surgical load is also quite good, so they get to operate a lot.
Thank you. Dr. Akash, would you like to add on to anything that you talked about?
Yeah. I would just like to bring a point to the notice that senior residency is with some subspecialties is only available in some prime institutes like AIMS or PGI. It's not readily available for everyone, and so people who have passed out from other medical colleges who would like to have a general ophthalmology plus a specialty, they only have an option of fellowship. Not everyone is accepted in the institutes like AIMS or PGS. So for others, fellowship becomes the most important option, I guess. And I've been trained. I have also done a long-term fellowship. So I've been trained. I've seen a lot. I've done a lot of social this thing camps also, and I've seen many patients. So I have done general ophthalmology plus a specialty. And then coming back to your government setup, you add up more value because you don't have to refer those patients to a different setup. So it eventually adds value to the government setup also, and the academic and skills that you can learn once you join the institute. So learning never ends. But once you are an expert, it is easier to learn the other academic things, I guess. That's my point.
So before we move on to the next debate, I'll quickly ask Dr. Pratima, who did not get an opportunity to speak earlier. Okay, Dr. Pratima, do you think, see, we all know the value of a long-term fellowship now. However, do you think that a strong SRship can still replace a premium fellowship from a premium institute? I'm not talking about a weak fellowship. I'm talking about a premium fellowship. Dr. Pratima, are you there?
Yeah, I think she's
Am I audible now?
Yeah, you are.
Yeah. So the thing is, definitely, if it is a strong SRship, so it can definitely replace. But the thing is, like in fellowships, as you said correctly, if it is a premier institute, so it will have all the facilities available, like all the machinery is available, everything. Like in a private setup, everything is there. Okay, all these fellowships are in a private setup. In government setup, if they have everything available and the teachers are also there and they are ready to teach, then SRship can definitely replace fellowships if they are being strongly implicated and the protocols are strict. So that is true, but it definitely depends how it is being implemented, how are the protocols, how the machineries are available, and how is the exposure. Because now we are considering that the person has done their residency and now they need a added up learning. They don't want to do the same thing which they are doing in their own residency program, something which is more than what has already been taught to them. So now it has to be a level, at least not one up, it has to be 5 to 10 times up.
Okay. Now, one quick question to Dr. SH, who did a senior residency at RP Center. And of course, it was not a focused oculoplasty training. It was glaucoma as well as oculoplasty. And if I'm not wrong, a part of squint also, I might be wrong, but it was essentially glaucoma and oculoplasty. Now, coming to today's time, Dr. SH, if you had to choose what you were going to do today.
No, I think RP Center senior residency is far ahead of any fellowship if it's a specialty senior residency, because it is 3 years of concentrated training, unlimited work, unlimited work. You can't imagine the kind of work you can do in 3 years, and administrative training as well. So it's a very good fellowship. Whereas in institutes, when you do a 3 year fellowship, the first year is comprehensive ophthalmology. From the second year, 1.5 years onwards, you go to subspecialty, and in the first year, you spend actually in secondary centers. Whereas imagine spending 3 full years in RP center in a niche clinic, looking after the kind of cases that you want to see for the rest of your life. That's actually a life-changing experience. Things may have changed now, I'm not very sure. But at my time, it was a very concentrated training in oculoplasty. And of course, you always get trained in two specialties at RP Center. One was glaucoma and the other one was oculoplasty. But of course, right now, there are very few senior residency programs which can stand up to good Indian fellowships. Most of the senior residencies are degenerated to training comprehensive ophthalmologists at a higher level. So basically, it is an extended residency, I would say. So if somebody is keen on doing a comprehensive ophthalmology fellowship, senior residency, a generic senior residency may be a replacement. But otherwise, if you want to get good, solid subspecialty training, you should choose a long-term fellowship. Having said that, fellowships are not recognized by faculty positions. That's the MCI rule, NMC rule. So if you want a faculty position, then you have to have senior residency. Otherwise, you can't become an assistant professor in a medical college.
Piyush, sir, can I just add one
Rolika,
short
for want
point?
of time, yeah, if
Yeah,
you can just
sure.
make it in 10 seconds.
add something for you, sir, if you let me.
No, I'm so sorry, I can't because
All right,
we
it's
are
okay.
already
Thank
too late. I'm disallowing Roleka also. So we'll ask you the question and you can bring that point up in the next debate. We'll quickly get the verdict of the judges and then we'll move on to the next debate.
Yeah, so Piyush, I think both of them put forward their points very, very clearly. And actually, it's like parallel tracks. They are not as Santosh correctly says. If your goal is to work in a government setup, you have to do a senior residency, and you cannot have the the luxury of a fellowship program. Also, if your goal is to practice as a comprehensive ophthalmologist in a tier 2, tier 3 city, brushing up all specialties in a 3-year senior residency program is the way to go. If you want to practice a particular specialty like oculoplasty or whatever, then you won't get that training in a senior residency. And as correctly Santosh says, there are very few RP center like places. So in that case, you're forced to go in for a fellowship program wherever. So I think both Sonam and Akash have put forward their points of view very clearly, and I don't think the way I saw it, it's not really a debate between the two. It's what the youngster is to choose as to what his future is going to be and then decide. Thanks.
Sonal, quickly.
Yeah, I mean, for me also, it is not about the decision left to, like which is actually better over here, which is more suited to your basically choice, ultimate choice. And if somebody has to go as an academician in a medical college, then the MCI rules are supreme. You cannot really bypass them. I have one senior resident who worked with at our center in SMS, and she worked for 2 years and 4 months, and then thereafter she went to Narayana Netralaya, and there was a opening in AIMS Jodhpur, and I asked her to apply, and her application was rejected, and that's when I realized that they are so stuck with that 3-year rule that even those few missing months, despite a 2-year further long fellowship at Narayana, was also not considered for that. So if that is the path that you ultimately want to go, there is no choice. You have to do a senior residency. But having said that, I also want to say that a lot of centers, when people are doing PG, their training is in some ways inadequate. And from there, if you want to directly go into a long-term fellowship in, say, cornea, and you have not practiced enough number of phacoemulsifications, ultimately you need that balance. So a year or so of senior residency, which is the norm, say in Maharashtra, in Rajasthan also 1 year or 2 year senior residency is becoming a sort of a shortcut with the bond and all. So in all those things, I think it is very essential that when one gets that period in between where one is able to practice the skills that they have learned. This is something in a way, you have longer residencies in other countries, but in India it's 3 years. And if you have not done it from a very good center, then you have not got adequate surgical exposure. So before specializing, you get that adequate surgical exposure in those years of SRChip, and thereafter you can go for a long-term fellowship. So I also do not say that one is superior over the other, but they're both different paths and can be merged if ultimately your goal is to be in private, but having done from an inferior center, you have to practice your skills also before going for a fellowship.
Thanks, Dr. Sonal. So we don't want our audience to move out either for dinner in the mess or go to sleep. So we'll move on to the fourth debate, which is an optional fellowship, which is going to be spoken by Dr. Raki de Cruz, and a mandatory fellowship, which is going to be propagated by Dr. Priyanka Rao. So, Dr. Raki, can you please load your slides, please?
Yes, sir. Thanks to Mos and Yosi for this opportunity. Is my screen visible?
Yes, you just have to go into full screen mode. Please go ahead.
So, ladies and gentlemen, I stand to argue that fellowship is not mandatory in ophthalmology, it is optional. So, just take the example of the senior professors that we see in our medical colleges. Without the structure of this subspecialty, they have operated across a full breadth of ophthalmology procedures like screen surgery, ocular oncology procedures, even retina surgeries like scleral buckling with remarkable proficiency. With limited learning resources, minimal guidance, and scarce training opportunities, yet driven by the curiosity and an eagerness to learn, they achieved excellence. So, if you choose the right postgraduate institute, a good PG center usually provides you extensive hands-on in SACs and also phacoemulsification. These two surgeries form 70 to 80% of the real-world surgical load in India. So, if you are a PG with independent surgical ability and an ability to handle complication, that means you already have the skill that direct to translate into earning and patient confidence. You don't need a fellowship for what you can and should learn during your residency. So many may argue that fellowships are needed for premium IOLs, toric IOLs, multifocals, ICL. But the truth is, most fellowships do not give hands-on training on these premium areas as well. They reserve these cases for the consultants, and fellows mostly observe or just assist. So these premium skills can be learned later through short-term hands-on or through working with a mentor for a few weeks. You don't need 2 to 3 extra years just to learn something that you can pick up in months. Your place of practice matters more than a fellowship. Fellowship may help those who want academic careers, research oriented careers, working in metro or corporate hospitals, pursue niche subspecialties like retina, oculoplasty. But 70% of the real world ophthalmologists living in semi urban, urban, or rural areas often see high patient load. They actually need a good cataract, a good glaucoma, and a basic retina care. So the success there depends upon your location and the clinical skills, not your fellowship certificate. So if your goal is to start your own clinic, fellowship is even less necessary. There you need good cataract skills, good managerial skills, good communication skills, and an ability to manage common conditions. For the specialty cases, you can hire a visiting retina, oculoplasty, or a cornea consultant once or twice in a week. This is the standard practice. You build up the team. You don't need to be personally trained for each and every subspecialty. So let me address the uncomfortable truth. Many fellowship centers in India are underpaid or unpaid, use fellows like cheap full-time workforce, extend the training for 2 to 3 years for the skills that could have been taught in just 6 months. The praise for it is your youth. You lose your best earning years, your youth, your beauty, your family time, your time to reproduce, and your delay in your financial stability. You work extremely hard with minimal surgical independence. So many of them have this FOMO, fear of falling behind your peers. You fall behind only if you stop learning. For that, you have to learn. You can do workshops, observerships, mentorships. None of this requires 2 to 3 additional years. So choose wisely. Don't waste your years in fellowship that don't give real surgical exposure. Plan your career and not someone else's institute. So to conclude, fellowship is actually optional, not mandatory for everybody in ophthalmology. Choose based on your career goals, your place of work, your family, your financial background. Don't fall for peer pressure and society pressure. So, fellowship is a choice, not a mandate. Don't sacrifice your youth, your financial freedom, and your mental peace for the fear of FOMO. Thank you.
Thank you, Raki, for not just finishing in time, but driving home some very essential points. Nothing short that I expected from you. We now have Dr. Priyanka Rao, who's going to speak on the opposing view of mandatory fellowship.
Is my screen visible?
Not yet.
Is it visible now?
Not yet. Perhaps your internet connection is a little slow, so if you can switch off your video and then hopefully it'll start. Okay, we can see it now.
Okay, yeah. So good evening, everyone. Yeah, thank you for this opportunity. I'll be talking in favor of making fellowship mandatory. So, as we all know, with the immense advances that have taken place in ocular diagnostics and ophthalmic surgery in the past few years, ophthalmology has no longer remained an end branch. So, let us look at our own PG courses. In most of the DNP institutes, though there might be a good surgical cataract load, the surgical exposure in specialty like surgeries is limited because they are more fellow oriented. Whereas in most of the MS institutes, though the trauma or specialty exposure might be good, the cataract numbers are not sufficient. So in reality, the PG courses, though they might be a strong foundation, but are insufficient to meet the current demand of patient care. Coming to the subspecialties, they like specialties like retina, glaucoma, cornea. In the recent years, they have evolved them like as complex fields which require advanced diagnostic skills and refined surgical expertise, which can be best met through a fellowship, which is a focused, structured, a supervised, and a skilled program, which is like with an expert guidance. So that will help in proper management and also patient safety, which is of utmost importance. Now, coming to those who say that, okay, leave aside the specialties, we'll stick to a cataract surgery, which is a basic or a minor surgery. So I would like to say, let us not underplay ourselves by calling cataract a simple surgery. It is a surgery which requires a very high skill set, and in current scenario, it has become like a refractive procedure with very high patient expectations, which can again be met through a fellowship, leading to better outcomes. So those who say that learning from practice, like an SR-ship, that can be an option, I would say that is like a trial and error method of learning, which is neither safe nor ethical. And especially when multiple options of fellowships are available in the current scenario. So without a proper fellowship training, there it can lead to mismanagement or late referrals, which can cause delayed diagnosis and treatment and poor prognosis. So again, we are compromising on patient safety. Coming to the point of training period, increasing the training period, I would say fellowship should be it can save a doctor from a higher complication rate from repeat surgeries and medical legal issues. So we should think of investing a few years in a fellowship so to save ourselves from these, and also it helps the patient and it prevents like preventable permanent visual disability for a patient. So coming from the financial standpoint, it should be looked as an investment in competence, and it also opens up a plethora of professional opportunities. Like in the corporate sector, it can lead to better pay scale, or in the private sector, you can do freelancing. So in the long run, it will help financially as well. Coming to people who say that the senior ophthalmologists, they might have not done fellowships in the past, but they are so successful, they are doing all kinds of surgeries. The scenario back then was different with a lot of limited options at that time. But in today's day and age, when the patients are so well informed, doing a fellowship is the need of the hour. So let's choose competence over just convenience. And I would like to end by saying that as we deal with something which is as precious as vision, fellowship should be made mandatory to safeguard patient interest, to uplift our professional standards, and to secure the future of ophthalmology. I would end by saying today's effort brings tomorrow's success. Thank you.
Thank you very much, Dr. Priyanka Rao. I mean, I don't think anybody could have given justice to such a difficult topic of making fellowship mandatory, but you spoke well. Now, because Dr. QBM has to leave, and I'm sure Dr. SH is also in a hurry to leave, I will just shoot off to them directly. Perhaps one question that I would also like them to add is that in today's times, is it really even ethical? I mean, the ethicality is of a lot of debate, whether you can actually practice in at least certain subspecialties without a fellowship, and then your opinion about this particular debate. So Dr. QBM, Dr. Sonal, and of course, we want Dr. Arshi's opinion on this also.
Yeah, so I think Dr. Rakhi put forward her point of view very, very cogently and clearly that fellowships are not mandatory, but that presupposes that you have a very good residency program and your professors, whoever is teaching you, has made you into a good comprehensive ophthalmologist. So then you can go out in the big bad world, practice, and take in the people from specialties, people who have done their fellowships to assist you in your practice. That is ideal. That is super. But unfortunately, the reality is different. We do find that if you want to be employed at all anywhere by any chain of ophthalmology, you need a fellowship you need to have finished at least one long-term fellowship, so that is required. And if you want to practice a subspecialty, then as Piyush correctly said, you need to put that certificate up that you've done a fellowship from so and so institute or wherever in whatever it is, retina or cornea or something, to have patients of retina and cornea coming to you, because they're quite savvy. They look at your website, they look at your references, and will not come to you if you have not done fellowship. So yes, if you have a superb residency program, like as Raki said, we had in our days. So the need for a fellowship was not there. We could go out and practice right away, but times are changing. Thank you, Piyush.
Perfectly summarized, sir. Dr. Sonal, Dr. Arshi, any quick words?
I agree with Quresh sir saying these things, that the earlier residency programs were probably much more suited. A lot of residency programs are still now in that stage in which they are becoming more perfect day by day, but they still are not. So no one size fits all. Whatever is your personal experience will help you move forward in your career. If you are in a tier 3 city, maybe you do not need that kind of fellowship experience, and you can get away with the shorter training and come back and do the premium IELTS as well, because that is what Raki was actually focusing on. And other subspecialties, definitely you need a longer training. So if we can move
Arshi?
on to the next debate, maybe, or
Arshi? Is Dr. Arshi there? Okay, so in a sense, like again, what Dr. QBM essentially said, that is that let me just add on. You're adding more value to your particular specialty. You're adding more clinical experience. You're adding more patient exposure. So that is what you're doing in your fellowship. You're more focused. So that is again going to take you forwards. It's just like another super specialization in, say, neurology as against internal medicine. So with that, we'll move on to the next debate. Don't mind me taking over, Gunjan. The next debate is we have Dr. Sunandini Bose, who's going to be speaking on observership, and she'll be the other topic would be short-term fellowship by Dr. Hiteshi Jain. So, Dr. Bose, can you please put on your presentation? I'm hurrying things up because it's quite late. Dr. QBM, thank you so much. In case if you will be leaving, thank you so much for staying right till the end, till almost 9:30.
Can I start, sir?
Please go ahead, ma'am.
A very good evening, everybody. At the outset, I would like to thank YOSI and Team MOS for giving me this opportunity today. So I would be speaking for observerships in ophthalmology, a YOSI perspective. So what is the young ophthalmologist reality today? That we have talent everywhere, but exposure is not. There is an intense competition for the fellowships. The fellowship expectations are increasing day by day. We have an early pressure to choose the subspecialties. We have limited access to the mentors beyond one center. We have busy clinics, but very limited one-to-one mentoring. We have variable and unequal surgical exposures across the various institutes. So how do we manage all this? So what is observership, which comes in play in this kind of situations? It is a short focused clinical exposure which helps you observe the OPD diagnostic and OT workflow. It helps you learn the clinical reasoning and decision making from the experts. There is no performance pressure, so it's a pure learning. It can be from a simple 3 days course to a 1 month or a 4 weeks course. It helps you learn how the expert think and not only what they generally do. It is a safe space to ask the questions without any performance pressure. So why it matters to us more is because we have an early exposure to multiple subspecialty. It prevents us to have incorrect fellowship choices in life. It helps us build the confidence before any fellowship application. It gives you an insight to the real world practice and it gives you access to mentors outside your institutions. Coming to resident, why it is powerful for them? It gives you an early exposure to subspecialty. It helps you understand the real life workflow before choosing any subspecialty or fellowships. It helps you learn the examination patterns and clinical reasoning. It helps you identify the role models and mentor under which whom you want to get trained and whom you want to follow the path. So for residents, it helps you understand the fellowship expectations better. It helps you decide where you want to go. For fellows, why it matters more is because it helps you refine your surgical judgment and case selections. It helps you learn the advanced techniques which are not available in your particular center. It helps you observe the complication management from different institutes and different experts. It helps you compare the different surgical philosophies from these experts. It helps you have a good building national and international academic connections where you can go into research publications. So for fellows, it helps you expand the professional network as well as bottom line, it helps you decide how you want to practice in life. So what observership can do? They can strengthen the CVs and interviews. They can help you open the academic and mentorship doors for you. It helps you provide the clarity and direction in life. It helps you open the doors for fellowship, research, and mentorship with the clarity, confidence, and connection. So what problems I feel that there were in short-term fellowship that I have attended, that most of these were the paid fellowships. There was no guarantee of cases in most of them. Some used to say that you will get 20 cases, but sometimes it was 18, sometimes it was 16. There was a season to season variations in these short-term fellowships if you want to do a surgical one. There's a performance pressure because if you do not do the surgical case one day rightly or you do not perform well, the next day the number of steps are generally not given, the complete steps are not given, and it is only beneficial if you do a minimum 3 month short-term fellowship and not all institute of a structured plan. So my final take-home message is that observership do not replace the training programs, but they help you sharpen it. So explore early, choose wisely, grow with clarity. For resident, it helps you explore. For fellows, it helps you refine. For both, it helps you grow with clarity. Thank you.
Thank you, Sunandri. That was very nicely summarized. I think you touched upon all the points that were required. So, Dr. Hiteshi Jain, can you please load your presentation? She'll be speaking about short-term fellowship. Dr. Hiteshi?
Yes, sir, I'm doing that. Just a minute, sir.
I hope it's not literally a minute.
No, sir. This is old device, and I'm so sorry about that.
It's okay. It's okay. Yes.
So is it okay if I keep my video closed? My internet
Absolutely.
is
Absolutely.
lagging and
No problem.
okay,
No
okay.
problem, Dr. Hiteshi.
I'm really sorry about that.
We can see the
Good
slide.
evening. Good
Can
evening,
you
everyone.
move it to full screen, please?
So it is on full screen.
If you come to the
Okay. What about now?
I think it should happen. You can start in the meantime, I think.
Okay, sir. Okay. Good evening, everyone. I'm Dr. Hiteshi Jain, and today I strongly support short-term fellowships over observerships because in medicine, especially in procedure-based specialties like ours, learning is not passive. And today, with my presentation, I will tell you why short-term fellowships clearly win. Short-term fellowships are structured, supervised, and hands-on programs. You don't just watch from the sidelines, you participate, you assist, and gradually perform under guidance. In contrast, observerships involve largely watching from the sidelines. It's like you're part of a team, but you're benched and you're only able to watch the game, not actually participate in it.
Your slides are not visible moving.
Yes.
The
Okay.
screen is stuck. We can just see the first slide.
It's moved now. I think she's manually moved it. Yes, I
No,
think
I am doing that now because it wasn't moving.
yes, please continue the same. Keep continuing.
Yeah. So skill development is where the difference becomes extremely clear. A fellowship shortens the learning curve through repetition and feedback. Real-time feedback from your mentors allows refinement of technique and therefore judgment, and finally efficiency. This is how competence is built. An observership may improve your knowledge theoretically, but you do not transfer that skill into execution. And a short-term fellowship gives you clinical confidence by supervised responsibility. In a fellowship program, trainees are involved in the actual patient evaluation, decision making, pre and post-op care. This builds accountability, which is extremely important in the real-world scenario. Observerships, however, involve no responsibility, and without responsibility, there can be no confidence and growth. From a career perspective, fellowship training programs carry significantly more professional weightage. Hospitals and institutions value documented hands-on experience. Fellowship certificates demonstrate the same. Observerships are informative, true, but they're often viewed as shadowing experiences, and therefore they do not translate into clinical trust. My experience was in both. I was a long-term fellow in Vitreoretina at Shankara, and I also did my observership in ocular oncology at Stanford in USA. I was exposed to complex cases and surgeries like subretinal biopsies, melanoma biopsies, which were extremely inspiring and enriching to watch from the sidelines. However, I received no hands-on. And today, sadly, I cannot translate that into actionable clinical or surgical skill. This slide finally gives us exactly why short-term fellowship is the clear winner. It gives you hands-on training. It teaches you patient responsibility and care. It helps you in skill execution and gives you great credibility career-wise. Whereas observerships are watch-only. They offer no patient responsibility. They are largely theory-based and they are of limited professional value. So in conclusion, medicine is a hands-on profession. And if the aim of short-term training is real improvement in skill, then short-term fellowship is the clear winner. And in choosing between watching and doing, one must choose participation. Thank you.
Thank you very much, Dr. Hiteshi. So everybody watching should learn from this. See the adversity that she has faced. We could not see the slides moving, but we could hear her, and it was very, very crystal clear of what her point of view was. Congratulations.
I'm
So
really sorry about that, sir. I did not know
we
that
we
could
could
happen.
hear and we could understand perfectly. I mean, you've driven all the points home. So I'm not going to ask any questions because we have, for want of time, we'll just quickly go to Dr. Sonal Kalia for her remarks, and Dr. Anaga Heru, who's there with us as well, for her remarks. Any other panelist, if they would like to make a specific point, please jump in so that we can move in to the next debate in the next 5 minutes.
I would like to say that, I mean, again, it's not one size that fits all. Dr. Sunandini made some really valid points. Dr. Hiteshi's personal experience is something that many people can learn from here. But again, observerships are going to have a lot of value still, because if you want to enhance your current patient workload with something which you are learning elsewhere and coming and adding to it, if you have a good patient flow, like in setups where there are, maybe a skill enhancement is only required. So observerships do have their place. They cannot really be said that they are just a waste of time. And again, short-term fellowships are also requiring time away from your workplace. Whether your center or your place is not allowing that is another topic. But observership is something that really can still be fit in as even in a your own personal leaves also you can take and go and do and come back. So in a way, I still would say that Sunandini has made really valid points for in favor of the observerships. You cannot really do away with them. They have their place. They are teaching a lot of people, particularly like those LASIK trainings that are happening. A lot of people have learned, that becomes a starting point. Thereafter, you can go in for further things. But yes, observerships do have their merit.
Dr. Anaga?
Yeah, I agree. Actually, you can be an observer and learn a lot, and you can be a short-term fellow and not learn. So even as a short-term fellow, you need to be very observant, and I think it all depends on how much passion you put into it and what you get out of it and what that institute offers you. So it's a very relative thing, but very well put from both the sides. Yeah.
Anybody else quickly? One last
So
one.
I would like to add, Dr. Piyush.
Yes, please go ahead.
Yeah, so very short thing. The thing is, we have many observership opportunities, but we have very less short-term fellowship opportunities. Like if I want to do a cornea short-term fellowship, that's not there, I feel. But if I want to do a retina short-term observership, medical retina maybe, so it's there. So observership in cornea, observership in refractive, observership in any other field is available in India, but not many short-term fellowships opportunities for per se. So I just wanted to add that. So that is
Perfect.
why we can't go ahead with many short-term fellowships.
Perfect. I agree with both of our
Just one
expert
quick
panelists.
point.
Aditi, can you
If
come in the next one? So I
Yeah,
agree
sure.
with both of our expert panelists. It's the drive that is going to decide how much you're going to learn, whether it's from an observership or whether it's from a short-term fellowship, apart from being focused and knowing what you want to do. We'll move on to the next debate, which is our last debate. And then if time permits, we can have a nice 10-minute discussion. So may I invite Dr. Nida Khan, who's going to be speaking about medical fellowship. Doctor, can you
Good
please
evening,
share
sir.
your slides?
Yeah. Am I audible?
Yes, madam.
Is my presentation visible?
Yes, just go on to full screen mode.
Yeah. Shall I
Yes,
start?
please go ahead.
Good evening, everyone. I'm Dr. Nida Khan, consultant UV and medical retina from Choitram Netralaya, Indore. And today I will be speaking for medical fellowship because not everything needs a scalpel. So it's a site which fixes the eye without requiring a 15-number blade and a prayer. So who are we? So medical fellows think about diagnosing a disease, while surgical fellows have the urge to cut something. So during our fellowship, we just learned to correctly diagnose medical disease and stabilize them, so preventing complications and delaying surgical intervention. And we involve collaboration with other medical specialties, which is very intellectually stimulating. Like being a uveitis specialist, I involved with a pulmonologist for my ocular TB patients, with a rheumatologist for HLA-B27 associated uveitis or JIA. And for neuroophthalmic cases, we collaborate with neurologists so that we involve with other people and learn from their specialties as well. Coming to work-life balance, medical fellows, they can just walk out of the OPD at 4 p.m. and you have more predictable working hours, but surgical fellows have to remain on call, perform procedures outside regular office hours, unpredictability with patient volumes and number of surgeries. So we see patients and there are no OR clock delays. We have a fixed schedule where for surgical fellows, the OT starts at 8 a.m. and finishes whenever the universe decides. Coming to fellowship duration, medical fellows have a shorter and more structured path to achieve expertise. So after completing our fellowship, we can soon join practice and just start with our experience, whatever we have learned. While for the surgical fellows, it all depends on a lot of things like the number of cases you are getting during your entire fellowship, and it takes years to master the highly specialized techniques that you learn. The time breakdown, medical fellows drink coffee for 20% of the time, discuss research 30% of the time, and solve complex diagnostic puzzles 50% of the time. Well, the surgical fellows actually do surgery 10% of the time, and the rest of the time goes for the paperwork pre-op and post-op. So when we treat chronic conditions like glaucoma, uveitis, and diabetic retinopathy, there is a long follow-up duration, so we can see over the long run the patient's satisfaction, progress, and challenges over time. And during medical fellowship, there is a reduced surgical risk. You don't face the same risk and stress as a surgeon, no potential complication of surgery. So we try treatments, we adjust, and nobody hands us a lawsuit the moment the microscope shakes. And for the surgical fellows, one slip and well, let's not talk about that in public. Medical fellowship is less physically demanding. Surgery requires precision, dexterity, long hours in the operating room. And there have been many studies which shows that over the long run, ophthalmic surgeons develop neck or back pain, and vitreoretinal surgeons are specifically at higher risk. And surgical ability declines with age. You may develop tremors and fatigue, while the medical judgment improves with experience. Coming to personality traits, medical fellows just read literature for fun, know 17 causes of optic neuritis and are calm, while the surgical fellows have the blood pressure of a hummingbird. Medical fellows have high IQ, while surgical fellows have high stakes. Yes, surgeons may earn more, but we don't buy expensive phaco machines. We don't worry about OT inventory. We don't pay for broken surgical microscope, and we save money because we don't throw instruments in frustration. So medical fellows We have a lot of emerging technologies in the medical ophthalmology field, be it intravitreal newer injection or gene therapy for treating retinitis pigmentosa, optogenetics, and of course the artificial intelligence which is emerging, and the telemedicine for underserved population. So heroes don't always wear scrubs. Sometimes they wear glasses and argue about fluorescent patterns. So why medical fellowship? Good work-life balance. You can enjoy managing chronic diseases. Significant relevance of medical ophthalmology in regions with a limited infrastructure. And you can focus on the latest advantage in diagnostic, and you have time for research as well. And you have lower physical strain. So a surgeon may fix what they see, but a medical ophthalmologist discovers what others miss. Thank you.
Oh, thank you, Dr. Nida Khan. I can certify that I completely enjoyed your presentation, and it was the right decision to ask a UVA specialist to make this presentation on medical fellowship. So with this, I invite Dr. Salma Tabani to speak on surgical fellowship. Madam?
Good evening to all.
Just stop sharing.
I'm unable to share. Could you please unshare your screen?
Yeah, sure. 1 second.
I can surely tell that Piyush sir was really enjoying the presentation. He was smiling throughout.
Correct, sir.
Let's end this
Kind of.
presentation first.
Sorry, I'm just
You'll have a end a screen right up on the top.
Yeah, stop sharing. Yeah, I got it now.
You'll have to invest a little more time in learning these presentations also, since you have so much of time, Dr. Khan.
Thanks a lot, sir.
This could be her strategy to divert.
Good evening to all. Am I audible? Is my screen visible?
Yeah,
Yes,
Dr.
ma'am. Just go to full screen.
Yeah. Is it visible now?
Yes, ma'am.
So at the outset, I would like to thank team Moss and YOSI for the opportunity given. So I'll be speaking on surgical fellowships. So what exactly is a surgical fellowship? It's a specialized post-residency training focused on advanced surgical technique within specific eye care subspecialties. So these includes cataract and intraocular lens fellowship, cornea, ocular surface and refractive surgery fellowship, glaucoma, oculoplasty and ocular oncology, pediatric ophthalmology and strabismus, vitreoretina long-term fellowship. Most of these fellowship include cataracts, SICS and phacoemulsification as a part of the long-term fellowship in most of the institute. It's very important to choose an institute wisely while looking for a surgical fellowship. Observe, talk to ex-fellows, look for the duration, the location, what is expected out of you, the type of hospital in which you are choosing a fellowship, the OPD diagnostic machines, especially for refractive surgery, the advanced diagnostic and surgical machines which are available at the institute in which you're planning to go for a surgical fellowship, the surgical chances, opportunities to assist, observe senior surgeons in complicated cases, whether the place has a bond versus no bond, the waiting period. Most of these surgical fellowship involves a high volume center where the fellow gets excellent hands-on training in simplex and complex cases, complication management. It is important to learn when not to operate, then when to operate during the fellowship. It builds confidence and precision that is difficult to attain during the residency alone. It provides mentoring and networking opportunities, working closely with the leaders in the field. It builds invaluable relationship and a strong professional network. There's a job security and differentiation. Edge in job application, having worked with the experts in the field. Presentation and research opportunities, and which helps to contribute to advancement in the field. So the pros of a surgical fellowship are it provides a dedicated in-depth clinical alongside a proficient outpatient diagnostic abilities and surgical exposure in a specific area. Get to work with multiple specialties and subspecialties. Observe, discuss, and learn under the guidance of expert mentors. Help gain expertise to manage complex cases and perform intricate surgeries independently after the fellowship. So I still remember my first strabismus case, which I did during my fellowship, and how that helped me do complex cases later independently after having observed and assisted my mentors during my fellowship. Enhanced career opportunities and earning potential compared to a general ophthalmologist or a medical fellowship. Post-fellowship recognition and popularity amongst general ophthalmologists. So we all have a retina surgeons who are saviors to the anterior segment surgeons. So the take-home message will be surgical fellowship is a significant investment that offers substantial reward for all those committed to a specific surgical niche. It requires careful consideration of the personal and professional sacrifices involved. And it is also important to understand your lacunae during your residency and then select an appropriate institute and subspecialty. Most important is to enjoy the path, whatever the journey is. Thank you.
Thank you, Dr. Salma. It was very nicely summarized. You brought everything into the picture. Now, I've been very strict with the timing since the last 45 minutes. So let me open it up to all the expert panel, especially Dr. Aditi, who wanted to make a point earlier. So we'll have a discussion for the next 10 minutes, and then we'll quickly wind up in the next 2 minutes after that. Dr. Aditi, do you wanted to make a point? Let's open it up to all the debate sessions. So not particularly this one. If you wanted to make any point you think is going to be useful for as a decision-making tool to our audiences, then please do go ahead and share it briefly.
Yeah, hi. I had one or two points to make about the observership versus short-term fellowship. I would say that if you've already done some fellowship or you're already practicing somewhere, then observership may add, because sometimes once you're doing those cases, just observing a few new techniques or some new steps makes you a better surgeon, and you need not do it every time hands-on, especially because I'm an oculoplasty surgeon. Not every surgery you get hands-on to the new techniques when you want to actually upgrade yourself. So that way observership may be of better help when you want to learn something new after practicing somewhere, because you exactly know what exactly you want to observe. Other thing about the fellowship necessity versus no fellowship, I would just like to make a point. Unless like you have seen what are the actual protocols, sometimes it is very difficult to know what exactly a good surgery or good diagnosis or good protocol is. So I have seen many people who did their residency were doing all the comprehensive surgeries, but once they entered the fellowship, they actually saw all the departments and came to know what exactly a good simple surgery like evisceration implant is, rather than just doing everything left and right without knowing the best and current protocols. So in that way, I would say fellowship may add in case you have not had a very good subspecialty backed up residency. So those 2 points I just wanted to make.
Roleka, you wanted to make some points in the past. Would you like to add them now?
Yes, I have already put it up on the chat box though. One second. So I already put it up on the chat box. The only thing that I wanted to mention was that those who have already done a fellowship in a specialty that you have trained, and now you've joined as a consultant in one of the medical colleges, you can actually take the initiative, discuss with the administration, and for the future generation at least, you can try to ask if they can combine a fellowship and SRship combination. It actually works. Like I have been able to do that in 2026, and we will be starting a fellowship in oculoplasty oncology, and that will be an SRship fellowship combination. So it's beneficial for the next generation. And we have to start somewhere, right? Like even our mentors trained the first fellow somewhere. So we're going to train our first fellow and it will be useful for them.
As
So
in
you see,
Maharashtra, it was earlier MS and DOMS combined in Mumbai. So,
right.
okay. Anyone else, would they like to add any points? It's
May I?
open.
Dr. Piyush, am I audible?
Yes, ma'am.
Yes. So basically, I want to add something in a broad spectrum. So first of all, you have to means any resident who has passed their examination, they need to answer two questions: what is their need and what is their interest? Okay. So the need would be like supposingly someone cannot afford the time to give for a long-term fellowship or a short-term fellowship. They have to start in a rural setting, and they don't require any fellowship at all per se, and they have done a good residency program, maybe a decent one, and that is enough for their setup. So that would be one thing. In that way they can either go for a direct practice, direct setup, or they can join some SRship program wherein they can complete their bond, then go for a lecturership and so on. The second thing would be you have the time, you have your interest, you want to pursue whatever you want to learn, and then my pathway for that, whatever I took, is something which I always dreamed of. So my pathway for that would be to go do a good residency program, then go for a selected fellowship program which I really want to learn, then to add up to that, to learn what is there internationally I would like to explore, that would be my pathway. And then if I need, supposingly, if I am a bonded candidate or something, I want to complete my bonds, then I would like to add up whatever I've learned in my fellowship to my bonded duration. That way, even if I'm like not getting enough number of patients in a private setup or a corporate setup of the fellowship program I have done, like if I'm a Konya fellow, I might not get such like cases in my corporate setup or a private setup, so that I can pursue in my SR-ship program. And along with that, after that, if I want to learn something new, then comes the observership durations. Like if I just want to learn maybe cares, which I may not have seen during my residence, means my fellowship. That time I can just go for a 1 week or a 2 week observership, learn that, come back, and then do that. So that would be my pathway whenever something new comes up, because that happens in a surgical, like any surgical field, that something or the other would keep coming up. How so? Like, however was your fellowship system, however good your residency was, there will be something new coming up that you can learn either nationally or internationally. So that you can add up with
Very
your
nicely summarized,
observership.
Fatima. It's very nicely. The cascade of events that you've described is
Yeah.
very nice. And anyone else would like to add something? Dr. Vaishali, please.
Yeah. Let me congratulate all the debaters. They did a fantastic job. They were all wonderful. And at every point, you have to think, oh no, she's right, and the other person is also right. So that's the thing of a good, very great debate. For me personally, it was the trip down memory lane, because from observership to short-term fellowship, and then how I came back to government job, and then there were like those who had did long-term fellowships also didn't get that much work, which I could do after completing my short-term fellowship. So it is all really different thing for different people, and what stage you have to do. So just a few suggestions. I would like to think that if say that if the fellowship could up the stipend amount a bit more, because as everybody has stated that people are in their late 20s and early 30s, so managing financially becomes a bit difficult. And secondly, most of us at government medical colleges are now well trained in subspecialties. So if we can have the SR-ship as fellowship in the state of Maharashtra, that can also be thought upon. That's all. Thank you so much for having me.
That's a very valid point, madam. Unfortunately, this is something that has been being debated since the last 2 decades. Even when 10 years back, when I was a fellow, many of the contemporaries, my friends, took up an SR-ship at RPC as well as PGI because of the money involved, and of course the training was equally good, if not better. So unfortunately, that is the scenario, that the fellowship stipend is far less as compared to what SR-ship pays. So with this, I will hand it over. So I'm going to thank everybody first for bearing with me. I've been putting a lot of pressure on everybody to finish in time. So thank you, Gunjan, my co-moderator, for allowing me to take over and making sure that we finish before 10 p.m. And thank you to all our expert panelists, our judges who were there. Sonal is the last lady standing over here. So thank you for being there until the last minute. Of course, Dr. SH and Dr. QBM gave excellent pointers. And as Chairman Scientific Committee of the Maharashtra Ophthalmic Society, I'd like to thank Dr. Anaga Heru and Dr. Nilesh for this wonderful meeting, conceptualizing it, and making sure that it gives a lot of new points as well as direction to the audiences, not just now who are listening in live, but also to the people who are going to watch the reruns. Big congratulations to all the speakers. It's a lot of efforts for those 4 minutes. Thank you, everyone. And I'll hand it over to Gunjan and to Dr. Anaga. And of course, thank you, Numerotech.
Thanks, Piyush. I think all of you all did a great job. The speakers were really good, and the panelists gave their inputs, and the judges were good too. So I think all in all, I think what we had conceived as a idea was to give a general overview about all about fellowship, and definitely I think our audience is going to love this. Thank you everybody for all this. Gunjan, over to you.
Thank you so much, everyone. and it was a very nice debate session, and we have been going on, and we've over exceeded our time limit also. So everybody must be hungry right now, I am sure. So let's move on to our dinners, and thank you so much Anaga ma'am and Piyush sir for giving us all the opportunity, and all the beautiful speaking presenters here, and all the panelists for bearing with us tonight. Thank you so much, and we'll love to hear your feedback from audiences as well.
Yeah.
Thank you Numerotech for backing us up every time. Thank you so much.
Yeah. Group pick. Yeah.
Yeah.
Thank you to the judges and the panelists and the moderators. Thanks.
So anybody from Numerotech is still there, or I just take the
Yes, doctor.
yeah.
You take it. Yeah. Gunjan, you can take
Yeah,
it.
yeah,
Yeah.
yeah, yeah. So okay, everybody cheer up. Okay, thank you so much everyone. Good night.
Thank you. Thanks
Can
a
I
lot.
just suggest one thing? Instead of a debate, why not keep it like when to go for short term, when to go for observership? I think that would be more guidance based, because here it becomes like we are pitting two people against each other when we actually don't want to. We just want to take some takeaway points from them to